Yeah, actually, it's my speech, my educational speech. It is about the assessment of patients for the locally resectable lung cancer. It is very important to evaluate the patient who had a resectable tumor because there are many modalities for treatment of lung cancer, including radiotherapy, chemotherapy, targeted therapies, immunotherapy, and also, of course, surgical therapy. And surgical therapy in selected patients, in the patients with stage 1A to 3A lung cancer, it is the best. Actually, it serves the best survival in these patients. So assessment of the patients with resectable lung cancer includes the assessment of the tumor, first of all, assessment of the stage, T and M factors, because you have to be very careful to select the patients, and especially stage 1A to 3A patients are amenable to our candidates for surgery. And also it includes the physiological assessment of the patients. And these physiological assessments actually consists the assessment of the lung function and also the cardiac function. And also there are some assessment factors that cannot be quantified. There are usually subjective assessment components, like the patient's frailty, like the performance status of the patients, like the will of patients to be operated. Of course, as a physician, we have to take these all factors into consideration before any plan for surgery in these patients. For the TNM evaluation, the patient should have, of course, cranial MRI. In all patients, it is needed. And there is a mediastinal evaluation of the patients, EBUS-TBNA, mediastinoscopy, mediastinotomy are the invasive procedures. PET-CT is a non-invasive procedure, but the accuracy is not 100%. In terms of physiological assessment of the patient, pulmonary function test is gold standard with DLCO measurements, but in some patients with limited lung function, a cardiopulmonary exercise test should be performed, and VO2 max should be assessed. After some certain very elegant studies, such as CLGB and the JCOC 0802 randomized studies, segmentectomy is a good option for the patients with stage 1A2 patients, meaning that the segmentectomy is a treatment of choice right now for the patients who had tumors smaller than 2 centimeters without lymph node metastasis. For this reason, it is more important than ever to evaluate the patients in order to, in terms of pulmonary function and the cardiac functions, because nowadays, actually in my practice, I found myself considering segmentectomy in more patients than before, because some of the patients can be resected with even the fact that they had very limited lung function. Of course, with staging evaluation and physiological evaluation, cardiac evaluation is one of the main factors, because when we look at the complication rates, cardiac complication is the most frequent one. So before the operation, planned operation, a very careful, thorough cardiac evaluation must be completed. But there is a problem with that because most of the patients had previous cardiac status, like coronary arterial disease, peripheral arterial disease, or some arrhythmia. For this reason, the evaluation and the decision-making criteria are not very solid, and there is no, unfortunately, established guideline for the cardiac evaluation of the patients. So at the end of the day, as physicians, as surgeons, our job is to evaluate the patients, and if, in order to understand if the patient is okay for the surgery, if the patient can tolerate the surgery or not. Of course, those evaluations should be completed before any decision is made during the multidisciplinary meeting.